American healthcare system is neither healthy nor caring. I don't think there's a person on the street that would say our healthcare system is awesome. There is going to be a major shift in healthcare in general. Everything is interconnected. Figure out your own instruction manual. Play bumper cars with it a little bit. It's a human body, and it's not about being right, it's about doing the right thing.
I think people have a vision of the folks who end up with an unhealthy heart. You know, they're the smokers or the drinkers. They're the folks who are eating too much or are obese. Those are independent risk factors, right, for cardiovascular disease. But then there's also folks who look really healthy, right? I'd love for you to talk about, you know, what do you see in those different kind of phenotypes, and how do we think about that?
That's a really common conversation these days, I think. And I'll start it by saying, you know, I think there's 3 misconceptions. First is that heart disease is for old people. Not true. The youngest heart operation bypass I've ever done was 28 years old. Right. Number 2, that your cholesterol is normal, so you can't have heart disease. Not true. You can certainly have a normal lipid panel, but the kind of the next layer of that lipid panel, which there's lots of information out there about right now, particularly if you look at ApoB and lipo(a) and those kinds of things, and just not to get too far in the weeds so that people understand, this just looks at really the more pathologic portion of the cholesterol panel. So in other words, you can have normal cholesterol levels, but a high percentage of the dangerous cholesterol particles within that.
And that's the LDL-C, right?
Yeah.
Those are kind of the bad.
Yeah, and there's a group of the ApoBs that are kind of the atherogenic ones.
Right.
Some that you can control with diet and exercise, some that are genetically sourced. And then I think the third is that if I'm exercising, I'm healthy and it doesn't matter what I eat. And I think you and I both know that you can out-eat any exercise that you do.
Truly.
You know, I mean, whether it's from a caloric standpoint or from a health span standpoint as well. I mean, you know, obviously in the lab, a calorie is a calorie because it's a heat measurement. But from a nutritional standpoint, that's not true. So I think there's that kind of basic misconception right from the start that people kind of get down this road of convincing themselves, you know, that I'm okay. Then there's the kind of next layer, which is this pre-diabetic layer of folks that 80% of pre-diabetics don't know. Now, I will tell you a story about myself. My son, who runs all of my social platforms and is very engaged.
He's a genius, obviously.
He's just like his mother.
Good.
He is very bright, and I give him a great deal of credit for all of our success, quite frankly. But he said to me, Dad, you know, why don't you put on a continuous glucose monitor? And I said, Max, I don't need to do that. He said, it would be interesting. You know, you eat right, you take great care of yourself. I was like, Max, if I need to put one on to prove to you what a great job I am doing, fine. I'll be happy.
I can't wait to hear.
Yes, I'm putting it right on the tee. I'm happy to do it. I said, it's a great idea. I think I should do it. So I put it on, and within 48 hours, I realized that things that I was eating that I thought were really dialed were not only spiking my blood glucose, which is a normal physiologic response. I mean, people get really freaked out when they eat.
That is what is supposed to happen.
That's normal, but mine was spiking and
staying elevated. Yeah. What was your fasting? Sorry, hopefully I'm not getting the punchline here.
No, not at all.
Dying to know, though.
Not at all. So my baseline to give you was 121.
Wait, you wake up in the morning with a 121?
Well, that was average. So I'd wake up in the morning, it'd be 98 or 101. Yeah.
You're pre-diabetic.
So I'm good friends with my internist who I work out with, and I started to show him my numbers. He looked at me, he's like, you have to get an A1C checked. He's like, are you kidding me? And it was 5.8. I thought that I was on the right track, but that which is not tracked cannot be improved upon. And until you know, you don't know. And so I fell into that 80% of exactly the kind of person that you asked the question about. And
now, if you went to a clinic, if you went to a doctor with a 98, would they say, well, come back to me when you have diabetes? Would they
you mean a
5.8? Yeah.
So it would depend on who you saw, right?
Yeah.
It would depend on
That's
who
what
you
I think
saw.
is kind of problematic, right?
It is part of the problem. And
now you're at a point where you're like, well, okay, that's too close for comfort for you, right? But for most Americans, unfortunately, they don't get flagged as aggressively, right? And they're like, oh, okay, I'm fine.
And you know how I answer that is, first of all, think about it. The A1C is a percentage number. So what you're looking at is the percentage of hemoglobin that has glucose attached to it. Well, you're talking about 5% is normal. That's a pretty small number.
Right.
5%. Well, then the distinction between pre-diabetic and diabetic is 0.1. If you go from 5.8 to 5.9, you're then diabetic. So I would argue that is exactly the time that there needs to be intervention, because this is like an F1 race, right? I mean, like, people are winning by milliseconds. It's not 2 laps. You just don't have that kind of latitude in a situation like this. So, we can all do better. We can all do better with our diet. I mean, things that I didn't realize, rice. I like rice. I don't like rice as much now.
I'll give you Marespe to reduce the resistant starch by 16%. Do you know how to do that? Oh, I'll tell you, it's been a game changer for my family.
Interest. Yeah. I mean, and it's been, since we've been following it so closely, I mean, I've been able to really dial it back so that now my average runs anywhere between 99 and 101, which isn't perfect. I'd love to get it closer down to 90. I'm going to have my A1C check next week, because I've kind of at that 3-month window, and we'll see what it is. So I think that a big part of it is being willing to have some intellectual honesty about things as well. And that's part of this piece that I think has to be included as we move into the next wave of healthcare is patient engagement. That's so critical. Now, that has to be met halfway from physicians that are refocused on patients as well, right? I mean, they have to feel like that relationship is there, because you made the comment, like, that's the problem. You go in and they're like, because a lot of them don't exercise themselves and don't believe that this is the path. I think that there's some really basic things that people can do at home to kind of start. Like, where am I? Just a waist to height ratio. It's really simple, because we know that adipose tissue, particularly in the midsection, is a direct risk factor for cardiovascular disease. Right. And it's really simple. You measure your waist in centimeters and your height in centimeters. It's either 0.5 or less. If you're greater than 0.5, it is an exponential increase in risk. So it's like, without a single blood test, check your blood pressure.
What is blood pressure, and why does it matter in terms of cardiovascular health?
Super simple, just to kind of the bare bones, is that blood pressure, to think about it as a risk factor, is the amount of resistance that the heart is seeing with each beat. Now, that's not the whole picture, but I think that is the way you should think about high blood pressure in particular, because that's where the risk comes from. Because as you get this kind of hypertone in your blood vessels systemically, that's what cranking up the blood pressure. The heart is having to work harder with each beat. It's seeing more resistance. Well, the heart is a muscle, just like any other muscle. And over time, that muscle is going to become thickened and less efficient over time. And so when you have untreated high blood pressure, not to mention kidney problems, and
that's the thing. It's not just, doesn't just impact your heart. High blood pressure impacts your kidney just as much.
None of these things happen in a vacuum.
Yeah.
No, everything is interconnected. Specifically, if we're talking about cardiac involvement, that's really where it comes from, is the workload that the heart is seeing. And increased workload over time is dangerous, because at some point, the heart is going to start to fail. And when we look at longevity, when we look at single elements in a workup that determine like how long is this person going to live, it's fairly simple. It's how strong is the heart pump? Patients with strong hearts do much better than patients with weak hearts. Ejection fraction, which is what measures the amount of blood that's ejected from the heart each time, is the indication of whether the heart is strong or not. Interestingly, we don't eject 100% of the blood with each heartbeat. A normal ejection fraction is somewhere between 60 and 70%, because some blood does stay in the heart with each beat. But that really is kind of the timeline that we see when we talk about untreated high blood pressure and why it's so important that it's treated early.
Is it possible to have, low blood pressure or kind of within a really healthy vascular event?
Absolutely. Many people do.
Talk about that.
And so
what's going on there? Like
yeah.
what are the other things that are happening that?
So, when we talk about heart problems in general, you have to kind of put them into two major categories. And the first is blockages in the heart arteries. And when I say heart arteries, that's arteries that are supplying nutrients and oxygen to the heart muscle itself. And we have three territories: the front, the side, and the back, basically. A heart attack is when the blood flow in one of those or multiple territories is suddenly shut off, and then the heart muscle becomes blood starved. That can happen with or without high blood pressure. The thing about any of these things independently is if you have them, yes, you are at increased risk of cardiovascular disease, but if you don't have them, it doesn't mean that you're not.
Yeah.
The second category is valvular heart disease. And we hear a lot about aortic stenosis now, just because we can fix the aortic valve through the groin. It doesn't require a big operation. And we can do it with the other valves as well. It's just not as common. And so a lot of the valvular disease is just senile, if you will. As we get older, a certain percentage of people are going to develop that, and a certain percentage, you're born with a genetic valve that, whether it has two leaflets as opposed to three, that degenerates over time. So when we talk about heart disease in general, particularly in my world, those are the two big categories. And the risk factors for those are very different. There's very few risk factors for valvular disease. In other words, getting aortic stenosis or a leaky mitral valve or mitral valve prolapse that then, progresses one way or the other. It's really blockages in the heart arteries that we're talking about when we're talking about risk factor modification, just to clarify.
So if we're talking health span and we're really trying to think about how do I optimize for my cardiometabolic health, how do you think about resistance training, zone 5, zone 2, what's like your kind of perfect stack, for yourself, or, kind of how you'd think about prevention or, just optimizing for health span?
Yeah, it's funny, but what popped into my head right now was I saw an interview with an 80-year-old guy who had been married for 65 years. And the question was, well, what's the secret to being married for this long? What's the key? And he said, well, it's not one key. It's multiple keys over the years to open different doors, because you're not the same person at 20 that you are at 30, and to have the willingness to go through those doors together and understand. And I think it's the same way. When we look at metabolic health and when we look at health span, because like, if you asked me that 10 or 15 years ago, I would give you a very different answer than I would give you today. But again, I think that mindset of how you do anything is how you do everything. And that if you set yourself up for lifestyle choices early in your 20s, that will then prepare you properly in your 50s and 60s, even though the intensity may be different earlier, which is normal and it should be and what have you. I think that's kind of the key. Now, if we're looking at the indicators, obviously VO2 max in cardiovascular health is the most powerful when we look at the actual data. And so I think that to remove cardio training from your regimen is just foolish.
Right. And we see that in the data. Like people who are not working their heart, I mean, their cardiovascular profiles are not good, and so lifting is so important. It gets you partially the way there, but it's not working your heart in a way that is really protective against all the things that you're talking about.
And again, I think it goes back to none of these things happen in a vacuum, right? And it takes multiple spokes in the wheel to turn this machine properly. Muscle mass is critical. I mean, I love Gabrielle Lyons. She is wonderful. And, the muscle is the organ of longevity.
Yeah.
That's just pitch perfect, and I think she's right. And I think that if I look at my own evolution through this, when I was doing really hardcore endurance type events, I was doing zero strength training back then. Zero. A lot of it was because of the time management, but it was also of like, I don't need to do that. I'm swimming, I'm running, I'm riding, I'm doing all these things. I don't need to do that. That's total misconception. Again, you need both. And I think that both of those pieces are really, really crucial. And then I think, again, the other unforgotten is, this mindfulness and recovery piece. I mean, let's look at heat therapy. The cardiovascular benefits of sauna are so powerful. And it's not that much time in the sauna. It's really not.
It's like 60 minutes a week.
Right. That 12 to 19 minute sweet spot. It's not that long. It's not that.
Feels so good.
It feels so good. When I don't do it, I really, really miss that. And I know it's good for me. And so I really enjoy it. And then, the other things like meditation and breath and oral health and what have you kind of over here. And I'm putting them over here as well.
Yeah.
But I think that all of these things really need to be the three legs of a stool, not on a line.
I think oftentimes we try to simplify things, right? And we try to give people things to focus on. And I do think there's a taxonomy. And I think resistance training is probably at the top. We talk about, hey, if you are so limited on time, lift weights. That's big. And then I'd put it number 2, I'd put zone 5. Sprint a couple times a week. I think that's so important.
I do. I do. I think that, and the reason I had that slight hesitation is because, like, I can't really sprint anymore from a running standpoint, but I do
like,
exactly.
Yeah, in the pool, like 100%. Yeah.
Just so we clarify that, just get to that.
Good clarification.
That zone 5 heart rate.
You need to get out of breath a couple times a week by whatever means that. 100%. Whatever it takes on a bike.
It's great when it's sprinting because the whole neuromuscular activation that you get from that is so good for you. It's just so good for your body. And as we age, just, being able to get down on the floor and get off and be strong and all those things is so important. And it does all of those things kind of in one fell swoop. I do agree that if you're gonna kind of parse out your time and your cardio training, some of it needs to be high intensity of some nature, whatever it is that gets you there.
And then the lower intensity, the zone 2, I mean, for mitochondrial health, the evidence is so overwhelming for men and women. I think it's just such a core piece of the programming, that needs to get fit in.
It's the reason it's the base layer for everything else that we do.
Right. And it's going to allow us to build the zone 5 more efficiently. It's going to allow us to strength train more efficiently. Like that, just that foundation of healthy mitochondrial functioning, like the fastest path to that is zone 2. Is that true?
There's no question that it is.
All right. Yeah, I really subscribe to that literature, that, the evidence that exists around that.
Why do you think that is? Just out of curiosity, because I have a theory, but I have no proof to it. I'm just curious. Why do you think it's a path to get there easier? So in other words, if you have a solid base.
I think it's just efficiency, right? When you look at it from a biological mechanistic standpoint, you're talking about cellular communication, right? When the cells are able to communicate efficiently, we reduce all that friction, right? We're able to adapt and respond to load and more effectively, right? And so I think it's really about, how do I create conditions where I enable my cells to communicate with each other properly? That's light behavior. It's zone 2. It's feeding windows. It's, it's just this basic stuff, right? It's sufficient, consistent, well-timed sleeps. It's not one thing. It's many things that I think enable this communication. But I kind of put zone 2 very much in that bucket of helping to facilitate that side of communication.
That is exactly the way I feel about it,
Okay,
because
cool.
I think what zone 2 does is it gives our bodies and at the cellular level an opportunity to accommodate. And that is what's so important. That's why it's the foundation of doing the other things. You know, if you go out and you're only doing zone 5 or you don't have that base, you get injured most of the time.
Right.
If you allow and you're patient to you allow your body to accommodate, whether it's to, move your lactic threshold or whatever it is, it can be cellular communication, it could be all of those things. That period of accommodation is what then allows your body to be responsive in a very different way when you push it.
We wanted to talk with you about just how you prepare for surgery. What are the types of surgeries that you generally do?
So I am a cardiac surgeon now. When I was first in practice, because I'm boarded in vascular and cardiac, and I was doing thoracic surgery, I was doing all of those things. And I was very excited about doing all of those things. And I was very, very busy. And what you realize is that you're really good at what you do every day. And to do thoracic oncology, cancer, and those are huge disciplines in and of themselves. And at some point you have to kind of, right? You got to make some choices. And so over the years, I've basically focused on what I'm really best at, which is heart surgery. And so that's what I do every day. And that involves both kind of the big incisions, the little incisions, doing procedures through the groins, through very minimally invasive type procedures, injuries of the blood vessels, things of that nature. And that's really how I have focused my day to day over the last about 15 years now, actually. So it's all heart surgery.
So, a lot of what you've talked about, I mean, you're in a scenario where you have to be ready for those surgeries. I mean, are you at a point where do you have to kind of get up for it? Is it like, a game? Like, how do you like think about it? Or is it so automatic at this point?
So I think it's like anything, there's a certain amount of routine in anything that you do every day. I mean, I've probably done 5,000 heart operations over the last 25 years. So yes, there is a certain amount of routine. However, I approach every operation exactly the same, and that is, I do a great deal of, just mindfulness going from step 1 to step done, if you will, on every operation, even the ones I've done many, 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 many times, because each one is a little different. And that along the way enables me to identify 3, 4, 5 potential scenarios where I'm worried of something that potentially can go wrong. And I prepare for all of those, because what happens,
it's like a SWAT. It's like literally just like preparing for a game. Like a sporting event.
Absolutely. Yeah. You visualize,
Yeah.
Then you plan for potential problems, because just like when you're in a sporting event, you don't rise to the occasion, you drop to your level of training. As much as we would like to believe that we're going to go here, like Tyson said, it's a fight until you get punched in the face, and suddenly you have to totally refocus, right, where you are. And look, there's plenty of times when things happen that I didn't plan for. Yeah. Nonetheless, I've been doing it long enough that I do have an opportunity to do that. And then the final step is that I always refocus on the patient that I'm operating on. Because to me, what I do is a privilege and an honor. And I approach every patient encounter like that. And I tell patients and their family that I'm going to care for them as if they're my own. And I want to make good on that promise when I walk into the operating room. And I think that if any of those things were to go away, honestly, that it would be time for me to stop. I get the question all frequently, are you scared before you go in the operating room? Are you scared in the operating room? And the reality is that there are certainly cases that I am more concerned about and that I get nervous, but that's good because that makes me prepare differently. But once I am in the operating room, I do not get nervous at that point. That is a different mindset for me when I'm in the operating room. There's no room for that when you're in the operating room.
Every surgeon I've ever talked to says the same thing. That said, all the surgeons I've talked to are elite, like yourself, like are really at the tip of their spear in terms of their profession. Your ability to show up in that moment too is, in large part contingent on how you take care of yourself, and obviously you take that really seriously. So I would imagine people are just fighting to have you as their surgeon.
That I don't know about it. It's like any relationship.
You think about it,
like I wish they did.
Yeah.
But yeah. I mean, I think that there is something to be said, and we kind of touched on it earlier about, going to a physician that kind of blows off an A1C that's maybe borderline. We're headed into a next phase of healthcare where people really want to know that the physician is engaged in the same type of choices that they're expecting the patient. You're setting an example. And it also, like, I don't tell a runner that I do an operation on that they're never going to run again. I mean, I tell them that it's going to take time, but you're going to get back there. I mean, I remember I was in practice for maybe 1 or 2 years, and I'd done an aortic valve replacement on a fairly young guy. He was maybe in his early 50s, something like that. And I was running a half marathon in Savannah, and I was like on PR. I mean, and PR for me was like a 1:42 and a half marathon. That was really, my wife and I were out the other day, and she looked at me, she goes, maybe we should get t-shirts that say, I used to be fast. I said, probably. Yeah, that'd probably be good. But I mean, I was moving. I was really proud of myself. And I hear somebody going, Dr. London, Dr. London, Dr. London. And as I turn around, this guy smacks me on the butt. It was the guy I'd done the aortic valve on. And he passed me.
I love it.
And beat me. And it was like that made my year. It totally made my year. And so I think that people are looking for that kind of support. Like, it's not that, no, you can't. It's like, all right, let's figure it out. Like, how are we going to scale what you really love so that you can still do those things in some way, as opposed to you're never going to run again.
Like, you want your doctor to be practicing what they preach. Like, I feel like that's pretty fundamental. That's not the norm. What's your take on that? What is the responsibility of a healthcare professional to really practice what they preach?
This is absolutely the same and in line with like personal trainers. If I'm going to hire you as a personal trainer, I want to aspire to be,
right.
I want to look like you. I want to be radiant like you are. I want, my skin to be clear, whatever it is. From my perspective, I mean, it's like, how do you validate and legitimize having that kind of relationship where you're, the biggest problem is, the engagement and getting patients to buy in and then to follow through. And if you're not doing those things yourself, I mean, it's like parent different.
I think that's why a lot of those conversations don't happen in full, because the person who's delivering it knows that they themselves are not
You're going to get
honest.
Me in all kinds of hot water.
I think sometimes we need to zoom out as a society. I think that we have a responsibility as citizens to take care of ourselves. And I understand I say that from a place of privilege. There's a lot of education. There's a lot of resources out there. So for people who have access to education, who have the resources, I think you have an obligation to take care of yourself, because you put an enormous burden on your family. You put an enormous burden on the healthcare system. So I think like sometimes it's important for us to zoom out and be honest about our role as a citizen.
Accountability. And it doesn't stop when, between the patient and physician line, it just doesn't. For people to take you seriously, that you've got to be walking the walk and getting it after it yourself. And it's got to show, right? I mean, and it shows based on how you take care of yourself. It's very obvious very quickly to patients when they walk in, where you are or not on that spectrum. And look, I don't deny that there's people that struggle. I don't want to belittle or underestimate the difficulty there. By the same token, yes, when you're just making bad decisions, even though we especially know better, and look, I'm just as guilty, I have to admit, but I feel like I am able to redirect and recourse myself because, again, as we talked about, life does this, and it's not a straight line to success. It's the willingness to pick yourself up and to admit that you didn't do it right.
And I think like the culture inside healthcare can be tough in that, I think the archetype who goes into the profession is inherently not self-serving and is inherently selfless. And I think that shows up in ways that are really detrimental for the human system, right? And how they're able to show up in their professions. It's like figuring out, okay, how do we shift the culture so as to still honor, kind of that selflessness and that beautiful archetype, right? But also create conditions where they can take care of themselves so they're not burning out, right? And that's just, I just see this in my data. So it hurts me to my soul, right? Where I see these beautiful humans literally do not have the capacity to meet the demands day to day. And you can see it in their eyes, right? It's so painful. They love their work so much, but they just don't have the capacity, right, to meet the demands. So I guess more broadly, sometimes just wonder what we can do from a cultural perspective inside, healthcare.
I think what you see is we leave a piece of our soul on the table. I mean, I think the people that care, that's what you see. And that's what you want. That's the difference, because when it good enough is never enough. You're always going to be willing to go to here. That's number one. And number two, that it's not about being right. It's about doing the right thing. And that doesn't mean that you always have the answer. I think those are the two things that really take you from good to great. Those are kind of, knowing your limitations and your bandwidth, and then being willing to really kind of give more. But I agree with you that it's like where's that line? Like, we've got hours that pilots can fly, we've got hours that train conductors can work,
Exactly.
the crane operators at the port, but our most precious commodity, there's no meter, and we're not good self-policers, because we're all, at least particularly of my generation, it was the grind mentality. And that has changed a little bit with an 80-hour work week.
Cultural norms,
But I do think that there is going to have to be a major shift in healthcare in general. I mean, we're obviously seeing some really dramatic things recently in the news where, the confidence in systems that are supposed to take care of us is to this point that violence now is the response. Did we really have to get here to know that we're broken? I mean, I don't think there's a person on the street that you would stop that would say, oh, our healthcare system is awesome. Walter Cronkite said in the late 90s, he said, the American healthcare system is neither healthy nor caring. That was back in the 90s.
And I would argue that I think the people are inherently caring, the majority. It's because their own health is so compromised that it's hard to show up.
Yeah, it is. And I mean, look, we all have that capacity changes so dramatically over the years. What I have found personally is that I have the energy to show up. The recovery time, I mean, if I'm up for, let's say, 24 or 36 hour stretch, that used to be like a 24-hour turnaround for me. Like, I would come home, sleep for a couple hours, go for a run, go to the office, and I was ready to go. Now it's a week. We really do need some real shifting in mindset. Clearly access is a huge problem. Communication is a huge problem. And I mean simple stuff like, how many friends do you hear, I called my doctor's office, no one answers the phone. I can't get a person. Okay, I got a person. Now no one has called me back. Now and that's just this layer. We need some really dramatic changes fundamentally, and if we go back to that old functional medicine model, like from the healthcare perspective, I look at healthcare as a three-legged stool where you have physicians and hospitals, insurance companies, and then medical industry, the device companies, pharmaceuticals, everything. And then supposedly sitting on that stool is the patient. Like that's supposed to be the center of all of our focus. That stool, in my opinion, has been flipped upside down and the patient is like stuck under the stool right now. I think that if we all just flip the stool back over and refocused on the patient, take care of the patient, not the profits, as the primary goal, the profits will come. It's just like going into business because you love what you do versus going to business because you want to make money. If you love what you do and it's what you're good at, you're going to be successful. I mean, it's the same thing.
One thing that I think is really missing, and again, just, in the research that I do, is that like, I just don't get how frontline healthcare clinicians don't have access to the same tools that I had as an athlete. You guys are like the highest perform, like the stakes are so high. And all of the high performance tools that go to our military operators and, our professional athletes, like frontline healthcare clinicians should get that and more. We should have high performance centers in every single hospital.
Yeah, we don't have a gym in our
Exactly. Like that is just wild to me. One of the most important things for us to solve as a society is to figure out how to care for our frontline healthcare clinicians.
I've never thought about it that way, but that's really, it just makes so much sense. I think it has a lot to do with like this fraternal, historical, it's always been this way. Yeah. This is the way it's going to continue to be kind of mindset. That's a real problem. Unwillingness to change is like a lack of intelligence. Being curious of the world around you and being willing to explore is like, right. Like why wouldn't we at least try something like this? I tell the hospital administrators all the time, like, you don't have a gym for your employees here. It would be nice if I had a case delayed that I could go and work out for 2 hours or whatever it is. I think you're right that analogy though of like top line athletes or military operators that are expected to function at a level at all times.
High stakes, high stress.
Right. Like all times, like have no opportunity to, strengthen their own to handle that. That's really interesting. I always find myself always thinking about it kind of from the, how am I going to make it better from the patient standpoint? Yeah. And very rarely think about, I blame our side more only because I think it's our responsibility. When you talk about, the education piece, like that's really our responsibility with patients and to focus and listen to people and sit down, like walk in the room and sit down. It makes such a difference. You could just feel I think to your point, like the bubbling up, of just like something's off here and we need to fix it. And it's great because I think that there's energy and momentum around our healthcare system and figuring out, okay, something's off, what are the entry points, to really make a difference here. And I think, we're kind of circling around them. The issues are easy. It's the path that's going to be like turning a battleship. I think that we can come up with some of these real fundamental areas that like would move the needle immediately. Totally. If we just like all decided to make these changes, but right. It's like the forces that are maneuvering this economically, yes, unfortunately, are so incredibly strong. Yeah. That it really becomes difficult. And a lot of physicians just given up. We've just kind of gone, it's just too big of a problem at this point. It seems. Oh, it really like all we want to do is just take care of the people in front of us. It has become so cumbersome just to maneuver that and navigate it on a day-to-day basis that you're like, all right, the least I can do is just try to push this to the side so that at least my priority remains where it's supposed to be focused at this point. I think, like you said, the bubbling up is a really nice way to think about it. And it's not bubbling coolly. It's boiling. Yeah. Yeah. That's going to hopefully motivate some change, that'll be meaningful. I hope so. Is there anything that we missed that you feel like we should
we should tell our listeners about heart health or anything in the area of longevity?
We all feel in many respects like we're drinking from a fire hose these days with the amount of information that's out there. And that can be really overwhelming. And I think that in the end, figure out what works for you. Don't get caught up in what someone else is doing or what's right for them. If you see something and you want to try it, that's great, but figure out your own instruction manual. Figure out your path. Don't be afraid to, play bumper cars with it a little bit. Like, it's okay. It's a human body and it's going to be a process for you, but this is such a personalized journey. There's not a right or wrong way to do it. There are metrics and guides that we can use to make sure that we're shining the light in the right direction. And I think that that's really important along the way. But most importantly, remember that this is about doing what's right for you, not what you think people want you to do or what your doctor thinks you should do. It's about really figuring out what works for you in your day-to-day life, because that's what's going to be successful.
That's beautiful. Thank you so much. So fun to chat with you.
Thank you. This was awesome. I really, really enjoyed it.